Testosterone replacement therapy, generally known as TRT, is a medical treatment meant to address low testosterone levels in males. Think of it as a bridge, helping to restore testosterone levels closer to the normal range for better well-being. TRT may be delivered using numerous techniques, each with its own set of issues. One frequent approach is by injections, when testosterone is administered directly into the muscle. Another alternative is transdermal patches, which deliver testosterone via the skin and into the bloodstream. Gels and creams are another popular choice, giving an easy method to administer testosterone straight to the skin. In certain circumstances, testosterone pellets may be placed beneath the skin, delivering testosterone gradually over many months. The selection of which TRT treatment is ideal for you is best made in conjunction with a healthcare practitioner. Factors such as individual requirements, lifestyle, and possible side effects should all be carefully examined. Addressing low testosterone levels is critical. Low testosterone or hypogonadism may appear in a number of ways, frequently hurting a man's quality of life. Fatigue, poor energy levels, and reduced muscular mass are frequent physical signs. Men may find themselves challenging to maintain their typical activity levels, feeling continually fatigued and missing the energy they formerly had. The effect of low testosterone goes beyond the physical sphere, typically impacting mood and mental well-being. Depression, impatience, and trouble focusing may all be indicators of low testosterone. Men may suffer a deterioration in their general sense of well-being, feeling less driven and interested in their everyday life. Changes in sex desire and sexual function are other frequent problems related with low testosterone. Men may report a reduction in libido, erectile dysfunction, or trouble obtaining orgasm. If you're having any of these symptoms, it's crucial to check with a healthcare expert. They can evaluate whether low testosterone is the underlying reason and discuss various treatment choices, including TRT. While testosterone replacement therapy may provide considerable advantages for men with clinically low testosterone, it's vital to approach this treatment with a balanced viewpoint. Like any medical intervention, TRT contains possible dangers and side effects that should be carefully examined. One issue is the potential for TRT to aggravate sleep apnea, a disease characterized by pauses in breathing during sleep. Testosterone medication may increase muscle mass in the neck, possibly blocking airways and aggravating sleep apnea symptoms. Another possible concern is the development or exacerbation of acne. Testosterone may activate the sebaceous glands in the skin, resulting to increased oil production and acne outbreaks. Furthermore, TRT may accelerate the synthesis of red blood cells, possibly leading to a disease called erythrocytosis. This increase in red blood cells thickens the blood, increasing the risk of blood clots. Regular monitoring of blood cell counts is required during TRT to reduce this danger. A detailed chat with your doctor will give a full grasp of the possible negatives and help you make an educated choice about your health. Common side effects of TRT traversing the terrain. While testosterone replacement treatment may be quite helpful in correcting low testosterone, it's vital to be aware of possible adverse effects. One typical adverse effect is skin irritation at the application site, especially with transdermal patches, gels, and creams. This irritation generally shows as redness, itching, or a rash. Using hypoallergenic products and changing application areas may typically decrease irritation. Some males may have fluid retention resulting to edema in the hands, feet, or ankles. Mood swings and irritation are other possible adverse effects since testosterone may impact brain chemistry. These mood changes are frequently modest, but may be addressed with lifestyle improvements, such with stress reduction measures and regular exercise. Open contact with your healthcare practitioner is vital for resolving any concerns and maintaining a happy experience with TRT. Significant side effects, unusual but crucial considerations. While major adverse effects from testosterone replacement treatment are less prevalent, it's crucial to be aware of these possible hazards to make educated choices regarding your health. One issue is the possible influence of TRT on cardiovascular health. Some studies show that TRT may raise the risk of heart attack, stroke, or other cardiovascular events, especially in men with pre-existing heart issues. Another dangerous though unusual adverse effect is the potential for TRT to accelerate the development of prostate cancer cells. Men having a history of prostate cancer, or those at elevated risk, should address this possible concern with their doctor. Furthermore, TRT may reduce sperm production, possibly leading to infertility. Men who are contemplating having children in the future should examine alternate treatment choices with their doctor. Open communication with your healthcare practitioner is crucial for recognizing and addressing any possible dangers. The significance of medical supervision, a guiding hand, beginning on testosterone replacement treatment, is not a choice to be made lightly. It takes careful study, a complete medical examination, and continued supervision by a skilled healthcare expert. Before beginning TRT, your doctor will do a full medical history, physical examination, evaluation, and blood testing to establish whether you have clinically low testosterone levels. This review helps verify that TRT is the proper therapy for your individual condition. Once you've begun TRT, frequent follow-up sessions are critical for evaluating your progress, modifying doses as required, and recognizing any possible adverse effects. Your doctor will monitor your testosterone levels, blood pressure, cholesterol levels, and other important health indicators to ensure the medication is safe and successful for you. They'll also be ready to handle any questions or concerns you may have throughout the journey. TRT needs specialized treatment and constant consultation with your healthcare professional to obtain best outcomes. The association between testosterone replacement treatment, or TRT, and cardiovascular health is complicated and a focus of current study. Some studies have revealed a possible relationship between TRT and an increased risk of cardiovascular events such as heart attack and stroke. However, some research have not observed this link. One possibility is that TRT can raise the chance of blood clots, which might block blood arteries and lead to heart attack or stroke. On the other hand, other studies have shown that TRT could benefit some elements of cardiovascular health, such as lowering inflammation and enhancing blood vessel function. Given the complicated and increasing knowledge of TRT's influence on cardiovascular health, it is vital for men contemplating this therapy to have a detailed conversation with their doctor. This conversation should involve a full cardiovascular risk assessment, evaluating individual risk factors and medical history. Testosterone replacement therapy, or TRT, typically generates worries over its possible influence on prostate health, specifically the risk of prostate cancer. While testosterone is needed for regular prostate function, there are concerns that TRT can encourage the development of existing prostate cancer cells. It is crucial to remember that existing data does not clearly indicate that TRT causes prostate cancer. However, men having a history of prostate cancer or those with a high risk of getting the condition should approach TRT with care before commencing TRT. A complete prostate health examination is needed. Assessment often involves a digital rectal exam, or DRA, and a prostate-specific antigen, or PSA, blood test for males with a history of prostate cancer or those at elevated risk. Close monitoring of prostate health throughout TRT is necessary. Open conversation with your doctor about your prostate health history and any concerns you may have is crucial for making educated choices regarding TRT. Deciding whether to undergo testosterone replacement treatment is a personal decision that involves thorough assessment of both the possible advantages and hazards. Think of it as a balancing act, evaluating the favorable benefits against the possible disadvantages. On one side, TRT may deliver life-altering benefits for individuals with clinically low testosterone. Increased energy levels, better mood, higher libido, and increased muscular mass are just some of the possible advantages. These changes may greatly boost quality of life, helping men to feel more like themselves again. However, it's vital to realize the possible downsides, including side effects including acne, fluid retention, and mood fluctuations. Furthermore, the possibility for more significant side effects, albeit infrequent, should not be disregarded. Ultimately, the choice to seek TRT is a personal one, best taken in collaboration with a healthcare expert. A comprehensive examination of your unique requirements, medical history, and risk tolerance is vital for making an educated decision. Navigating the realm of testosterone replacement treatment demands a balanced attitude, understanding both its possible advantages and hazards. It's like beginning on an adventure. You need a clear route map, a trustworthy car, and a trusted guide to reach your location safely. If you're battling with symptoms of low testosterone, realize that you're not alone. Seeking treatment from a healthcare expert is the first step towards reclaiming control of your health and well-being. They can give assistance, run appropriate testing, and assess whether TRT is the best approach for you. Make educated choices, emphasize open communication with your doctor, and take an active part in controlling your well-being. Looking for high-quality supplements backed by Dr. Andrew Huberman himself? Check out the links in the description below and subscribe and hit the bell icon if you've learned anything new or anything of value.